We're here with my preceptor and we're going to do the first part of the video where we're doing a Q&A. So let's begin.
Hi. Okay, Albert. Let's talk about radiation. What is a radiation monitoring device called?
A radiation monitoring device is called a dosimetry bench.
How does it work to measure exposure to radiation?
So the way it works is by the technicians wearing it where it's supposed to be worn and wearing it every single time that it's supposed to, that you're being exposed to radiation. It works as a monitoring device.
Okay. Does it read the radiation?
It reads the scatter radiation that you're exposed to.
Okay. Yeah, I guess how do we obtain readings?
So what you do is, my clinic in particular sends these out every quarter, so that way they can get read by a third party, and then the report is sent to you later, so that way you can make sure that any of your staff member doesn't have overexposure.
When should it be worn?
It should be worn every time you're doing radiographs, producing radiographs.
Where should it be worn?
It should be worn at chest level.
What is the MPD for veterinary staff annually?
The annual allowed MPD is 5 REMs per year.
Okay. Let's talk about PPE. Demonstrate how to put on your PPE, including the dosimeter badge.
Okay, I'm gonna go behind the camera real quick. So I'm gonna go ahead and put on my vest. I'll do that after. Okay, putting on my thyroid guard, putting on my badge, then I'll go right here and I'll put on the gloves. Something that we don't have available at our clinic are head shields or eye goggles. And just so right now, since I have the PPE on, I'm going to also do a visual inspection. So for example, these gloves have a small little tear, so I would probably report that to my manager or supervisor. The thyroid guard, I'd probably look at it, see if there's any deep creases or cracks or holes in it. It's actually very intact. Badge. And then my vest, if you have it hanging, you can inspect it for any cracks, holes, make sure it's nice, complete, and it looks good.
Great. Perfect. So, just discussing general radiation safety. Can you list and explain the 3 methods of restraint used in radiology?
There's chemical, so that way the animal is sedated, so that way you can safely take radiographs. There's physical, where you manually restrain, so like if a tech is stretching out the limbs, so that way you get a proper radiograph. And then there's also mechanical, where you would use things like gauze, you could use sandbags, you could use a slip lead to kind of restrain a little bit.
What do you think some benefits of chemical restraint are?
Honestly, you get safety first because you don't have to worry about the animal hurting itself or the person hurting itself. You don't have to worry about getting bitten or stressing out the animal, so that way you can get the best image on the first try.
Perfect. How do you think sedation would help decrease your MPD?
So whenever an animal is sedated, you can properly position them so that way you don't run risk of being exposed. You also can probably leave the room and to make the exposure, so that way your exposure risk is very low.
Great. Let's discuss and show me 3 positioning aids that you use in radiology.
So if we go here to the table, you can actually see these are different types of troughs. This is the foam trough. We would use this to do like a VD. Then you have the rice sock, you have the sandbag, and even the gauze you can use like to stretch out a limb to go ahead and get a radius ulna or a femur if you needed that.
Okay. So what is maybe one other positioning aid that we don't have here that you could use?
Probably regular, a lot more sandbags. I know we only have one, so it kind of doesn't help. So if we had more just to help, like let's say if we're taking radiographs on a cat, this one probably wouldn't be ideal. So if we had some smaller ones that are more size appropriate, just because that's very heavy.
Yeah. One other thing that you can always use are foam blocks.
Oh yeah, the foam blocks, like if you're doing chest x-rays, a lateral chest x-ray, you know how the chest is kind of oblique shaped. You might want like a foam triangle to help steady that image, so that way you don't get an angled when you do want a straight view.
Perfect. What are some of the physical protective barriers that can be utilized in the radiology suite other than PPE?
Distance is a really big one. So like once you have your animal positioned, if you do use chemical restraint, you can distance yourself from the primary beam. So this specific area, you can try to be as far as possible. So like if I'm restraining an animal, I should look away. I should make sure that my hands aren't in the primary beam, and just really distance yourself from this area, so that way you don't get any primary beam radiation.
Great. So you just explained a big thing that we talk about a lot with safety is distance. What about the exposure time setting on the machine?
So the machine, you can adjust the exposure time. Anytime you extend the exposure time, you really do run the risk of exposing yourself to more radiation. So you want to try taking the least amount exposure as possible, so that way for safety for the pet, for the animal, and also for yourself.
Great. So can you explain to me why no portion of any human, shielded or unshielded, should ever be exposed to the primary beam?
So the PPE that's made, it's only made to protect you from scattered radiation. So if you put your hand in the primary beam, even if you're wearing a glove, your hand is exposed to that primary beam, so it's getting direct radiation. So you honestly want to make sure that you're nowhere near this primary beam, so that way you don't get excessive radiation.
Yeah, great. Which again is another great reason that distance is a good protective measure, since we're moving you from the primary beam. So, nice. Why should non-essential personnel be removed from the X-ray suite during exposure?
So the first reason is because you don't know whether or not they're fully wearing their PPE, if they're wearing their badge. You want to make sure that they are fully geared up, and that only the people necessary for the radiograph are in the room. Sometimes the doctor will give you specific instructions, but even then the doctor just comes in, makes sure that the techs understand, and then they'll leave. And just for safety reasons, so that way nobody gets exposed to radiation that doesn't need to be exposed to it.
Great. So speaking of people who shouldn't be exposed to radiation, let's talk a little bit about pregnant women and youngsters under the age of 18.
So scientifically speaking, their cells are rapidly dividing, so you don't want radiation to get exposed to those cells, because you can damage them in many ways. There's a chance of not harming them. There's a chance of temporarily harming them. There's a chance of damaging them past reproduction. And then just a chance of harming them completely to where they're not used. So it's been scientifically proven that people under the age of 18 and women that are pregnant do have a high risk of radiation exposure. So the women that are pregnant do need to speak to their physicians if that is their work, like a female veterinarian or a female technician.
Yeah, so you mentioned that people under 18 and pregnant women have a higher risk of radiation exposure. But I think maybe what you meant was that they have a higher risk of radiation damage. Is that right? When they have the exposure?
Yeah, just because they do have rapidly dividing cells that do run the risk of getting exposed to it because they're rapidly dividing. And also that's why we wear certain protective gear like our thyroid guard, because that is an area of where cells rapidly do divide.
Yeah. So those cells are going to be more susceptible to the damaging effects of the radiation. Why should we make every effort to obtain diagnostic images on the first exposure?
So every single time you're taking a radiograph, you should do your best to make sure that you're getting the best diagnostic quality image available, because you are exposing the dog to radiation as well as yourself. So anytime you have a dog there, and you always want to check twice and cut once. So you just make sure you do meet the parameters for your image. Make sure the dog's relaxed. Make sure you catch it on the intake or release of the respiration. Just that way you get the best quality image, so that way the dog isn't overexposed or you don't expose yourself to excessive radiation.
Yeah, great. What are...
Hey guys, right now we're looking at a dosimeter report. I'm just going to go ahead and explain these columns to you. Right here, the first column is going to be the pin assigned to the user. The second column is the user's name. The third column is the type of monitoring that it is, standard. 82H represents the type of badge that we use. CH is the chest. This is the quarter that the radiation was being monitored. And then if you notice the next few ones, column 7 through 14 are ND. That just represents that there's no measurements that were detectable, so it didn't need to be interpreted. Then if we look at our last ones right here for Dr. Red, 10 and 11, those are our column 16 and 17. That stands for lifetime cumulative eye dose and lifetime cumulative shallow dose. But one cool thing is, if you look, you'll notice this is in millirims, which means it's a lot less than rim. So Dr. Red is under the MPD for this year. So today we're going to do a craniocaudal x-ray of Ryuk, radius ulna, right here. So right now I'm just putting it into the system. I'm putting the account number, the name. Ryuk is a boy, 11 weeks old, unaltered. I'm putting my initials, Jennifer's initials. We're not using sedation or anesthesia, so I click register. And this is Ryuk. This is Jennifer. Notice we're also wearing our PPE, our thyroid protectors, and our vest. So just coming over here to this menu, you click on cat, click on the appropriate one. Since it's gonna be craniocaudal, I'm gonna click that one. I'm gonna go ahead and take my measurements right now. So we're just gonna put them in position. We're actually gonna use the other arm, even though that looks like I need X-rays. Okay. Okay, I'm measuring the widest part. Okay, I'm getting 2. Okay, I have that. Now I just want to go and get my marker in there. So this is going to be the left side, so I'm going to go ahead and make sure that I do put the left in there. And just to go over some of my aids that I'm going to be using today, I'm just going to be using some little rice socks. This will help me just keep Ryuk in a lateral recumbency. No, I'm sorry, not in a lateral recumbency, in a sternal recumbency. And then I'm also going to use this stretch gauze. I'm going to put it around the paw and kind of just help pull it, so that way I collimate what I want to view. So since this is a radius ulna radiograph, I'm gonna go ahead and do the joint of the carpus and then the joint of the elbow. Okay. So I'm just gonna go ahead and show you how we're gonna position him. Then my camera person is gonna step out, and then she'll come back in after the X-ray, and I'll show you the image on the computer right now. Okay. So if you look at her.
What are you doing? Come on, girl. Pull this little leg back.
Okay, I'm just gonna put this around her little palm. Tighten that. I use that to pull. Okay, we'll get her position. Just gonna use the little rice socks to help keep her lateral. Okay, I'm gonna want the middle of the radius on her right there at the cross. Okay, and I'll use the marker. I'm gonna try that one more time. And right now we're just positioning her. That's why we don't have our gloves on. Whenever we actually take the radiograph, we will, just to make sure that we are being very safe about taking these x-rays. Okay, so that's how I would do it. We would also look away from the x-rays while we do it. So Yuri, our camera woman, will press pause on the video, step out of the room. We'll take this x-ray and then we'll show you the image shortly, okay?
Zoom.
Okay guys, so Jennifer went to go take Riley back to his kennel. We went ahead and took the x-rays, we took off our gloves. This is the actual image if Yuri wants to go ahead and zoom in a little bit. So notice the marker, this is his left arm. Notice we got the joint of the elbow as well as the carpus. So I'll go ahead and submit this x-ray, this radiograph to my teacher. Thank you. Guys, so we're about to do a VD thoracic view on Maggie. So I'm gonna go ahead and put her into our x-ray machine. So right now I'm registering her study. So her ID number is 171229. Name is gonna be Maggie. Her last name is Lara. Okay, she's a female, 11 weeks. Okay, so I have that registered right now. Guys, so okay guys, so Maggie's in the system. Now I'm just gonna go ahead and show you the display. So I just clicked on the dog image, I clicked on the chest. We're gonna do a VD. I'm about to bring her in and we'll measure her, and we'll decide what the parameters we're gonna be using. Okay,
let's record now.
okay.
Yeah.
Okay, you guys, so this is Maggie. So, before I get her in position, I'm just going to go ahead and measure her. Since it's going to be of the thorax, I'm going to go ahead and measure her at her widest. Okay, so I'm getting 13. And then right here, the total adds on 2 centimeters. Okay, so I'm going to go ahead and just get her into position so that way we can see how we're going to do it. Okay. One person's gonna hold her off on top to make sure her legs are stretched forward, and then I would hold her other legs like this, and we're gonna go ahead and I'm just gonna go ahead and get her in the V trough. I already set it to 15 centimeters, and I'm just gonna go ahead and fix the collimation. I'm sorry, Maggie. I'm just gonna go ahead and see where I'm at before I put her in the final position. And I'll pause the video and then I'll show you the result of the x-ray, okay? Okay guys, so I got her where I want her. I'm going to go ahead and pause the video, put on my gloves, and I'll take the x-ray. Notice I got the marker right there. I've already collimated so that way it gets the closest image possible. I'm going to press pause, take the image, put on my gloves, and I'll show you the image in a little bit, okay? Okay, you guys, so we got Maggie out of the V-trough, and this is the image. So just notice I got her thoracic inlet right there. It's a little long, and I got the marker right there. There's Maggie. Into the computer, so you click right here on the ID. You type in her ID 171229. Go ahead and adjust the information. Her last name is Lara. Her given name is Bonnie. Put the sex, the age. She is altered. Text today will be me and Dr. Red. She has been sedated and no anesthesia, so you click registration, so she's ready to go. Right now I'm gonna go ahead and suit up in PPE. So I'm gonna go ahead and put this on. Put that on. Snap that. Put on my thyroid guard. I'm gonna put on my dosimeter badge. Then Dr. Red will do the same thing. Set the settings, so you click on the dog icon, click on the pelvis, select the VD. Right now I'll know the measurements after I go ahead and use the caliper. So we're gonna go ahead and flip her into dorsal. Come and see. Okay, I'm gonna have her position like this. I'm gonna measure right here. And then Victoria, can I get you to zoom in right here? I'm getting about 9. So then I'm gonna go and place 9 right here. It's already been set. And then so since this is gonna be her left side, I'm gonna place her right. Place the marker right there. I'm gonna slide off a little bit. Okay, I'm gonna go ahead and put on my gloves. And then just to talk a little bit about the collimation, we're going to go ahead and center down her midline. The top of the collimation should be right above the crest of ilium. So it's going to be a little bit right there. So I'm going to scoot her up a little bit to right there. And then caudally it should be distal to the patella. So I need to just shorten that a little bit more. Just to right there. And then laterally, it should include her trochanter, which would be somewhere right there, okay? So we got her positioned. I'm gonna go ahead, whenever I'm holding her legs, pull them straight to where the patella and her toes are parallel with the table, okay? So I have her set like that. I'm going to put on my gloves and we'll make the exposure. And Victoria will step out and then she'll step right back in right after, and I'll show you the image. Okay, so Victoria, do you want to press pause? Okay, so we can go ahead and look at the image on the computer. See the marker? Okay, thank you. Hey guys, so doctor requested me to pull up some x-rays, so I'm recording it right now to show you how we do our file and store our images. So I'm sorry, so right here you click on database and you just select, so if we were going to look for any x-ray, any radiographs for today, we click on today and yesterday, 1 week ago, 2 weeks ago. I know that Roxy, the one that the doctor requested, is actually on the 9th or 10th of June, so I'm just going to click on 1 month, and then I just kind of look through here. I go ahead and I found it, Roxy Laura. It shows what time. It actually shows me as the technician. I'm gonna pull that up, and then down here, this gives me those images. Okay. And then it has this information: owner's name, pet name, and it has where we did the X-rays. Shows more information right there. So those were the 2 images that we did. Those were actually images that I did for my lab practical. Thank you for watching. Hey guys, so right now we're gonna go and record my contrast study. I decided to do the pneumocolon. So right now I'm just gonna go ahead and set it up in the system. Go to exposure, register study. Count number is gonna be 171229. Last name is going to be Laura. First name is going to be Bonnie. Okay, she's female. She's about 7 years old. Text will be me and Yuri, and also Dr. Red. Okay, so I click register study. Okay, have that in there. Now I got to go to our machine, and I'm gonna click on new exposure. Okay, dog is gonna be on the colon, and we're gonna do VD and laterals. So I'm just gonna select that. I'm gonna go ahead and pause the video right now. I'm gonna suit up. I'll bring Bonnie, and then me and Yuri will go ahead and take some images. So I'll go ahead and show you with a suit up, and then pause the video, and I'll show you the images after. And then Dr. Red will come in and put let me also go over the supplies too. She'll go over this right now. So some of my supplies are gonna be OB lube, a 60 milliliter syringe, and then a silicone coated latex Foley catheter. Okay, and then we'll discuss this later in the video. Okay, I'm gonna go ahead and press pause, and I'm gonna get suited up with my vest, my thorax protector, and we'll continue. Hey guys, so first off, this thyroid guard, not thorax. So this is Bonnie, Yuri. We got on our thyroid guard, our vest. We got on our dosimeter badge. Yuri's is right here. We're gonna go ahead and put her in position. We're gonna take a lateral and a VD of her abdomen, just so that way we have the survey X-rays, and then I'll go ahead and press unpause on the video to show you the X-rays, and then Dr. Red will come in. We'll place the Foley catheter and then use a syringe to put air in her colon just to take those contrast studies. Okay. I just wanted to show you y'all the images that we came up with throughout the study. So what we're looking at here is the initial image, the lateral image of the abdomen. Notice you really can't see the colon. And then this image is going to be the VD. And then this third image is going to be the lateral. This is where we did about 20 milliliters of air as the contrast medium. Then we did additional 40 in this one. And then Dr. Red was saying that this one you can start seeing the contrast in it. She did say she was full of feces. This one is the fifth one. We did 20 more milliliters of air. Dr. Red said that this one made the colon well defined, and you can really see where the colon is located. And then the sixth one is gonna be the VD of the abdomen. Okay, and that was a contrast study. And just so that way you see what we used. I know I explained it earlier. We used a small 12 milliliter syringe, a big 60 milliliter syringe. We used some lube. Those are the gloves, the packaging, the Foley catheter, and then paper towel. Thank you.
Hi, my name is Rachel Red. I'm a doctor of veterinary medicine. I work at SPCA of Texas, and I have the pleasure of being Albert's preceptor this year. So I'm just going to talk a little bit about his radiology skills. I think that he has shown great improvement since starting the class earlier in the semester. When we first started, Albert didn't know a lot about positioning or collimation or just radiology techniques. I think he was a little bit nervous or fearful about radiation exposure, and all of those things have greatly improved, and I hope that his nerves about radiation exposure have decreased a little. So I have really noticed that he takes a lot of time when it comes to performing radiographs, especially with positioning. He's definitely taking advantage of using equipment that we have available, such as the soft troughs and gauze, and teaching other students and technicians, assistants, how to use those things, which is great because now we're utilizing those things more often than we were before.